Patients who have been diagnosed with a terminal illness often deal with anxiety due to being unable to control their own fate. However, in August, Federal Health Minister Hajdu announced exemptions to allow access to magic mushrooms for end-of-life distress. The move was celebrated by many doctors, including some here in the Northwest, but as Adam Riley reports, some doctors are now asking the government to go one step further and allow them to try the drug before advising it for their patients.
You basically go through the experience of what your patient will be going through. So you experience the altered state of consciousness.
Dr. Pachette-Marble is a physician based out of the Marathon Family Health Team who has a patient who is dying due to a terminal illness and, like many facing an inevitable death, is experiencing mental distress as a result, and normal treatment options are just not working.
So that means medications like antidepressants, anxiolytics, psychosocial interventions like counseling. Studies show those generally aren't effective, or if they are, it's not very much. And this person has tried those and failed those options.
However, this patient has the option of using Psilocybin or magic mushrooms as a recently approved method of treatment by the federal government. Pachett-Marble is one of 5 Northwestern Ontario physicians who are lobbying the federal government to allow them access to use the mushrooms themselves. He says by allowing doctors to take training and experience the effects, it will make it easier to help patients through the treatment.
This is not like when I prescribe antibiotics for a urinary tract infection. I don't need experience with the antibiotics. That's prescribing. This, I think, is more akin to being a guide. And if you think of any other analogies of a guide, you want your guide to have personal experience in the terrain they're guiding you through.
Pachett-Marble equates the situation like going on a safari. Do you use the guide who knows everything but has never set foot in the region? Or do you go with the guide who has experienced the region firsthand? Federal Health Minister Hajdu was unavailable for an on-camera interview. However, a spokesperson for her office did offer this statement regarding the request by the doctors. Health Canada thoroughly reviews all requests for exemption and makes decisions after taking into account the risks and benefits. We still have much to learn about the risks, which is why the sale and possession of psilocybin is still illegal. Until there is sufficient evidence base, Health Canada will review each request for an exemption on a case-by-case basis. Pachette-Marble hopes the government will accept their case soon due to the amount of time his patient and others have left.
There's all these patients now lining up to get it, but there's very few people trained properly to actually provide it. And I think we need to look at that next. And I'm hoping that the Honourable Patty Hajdu will seriously consider granting the Section 56 exemptions for physicians and therapists so that they can get the training they need to provide the treatment properly and get the best benefit for these terminally ill patients suffering.
Adam Riley, TBT News.